Of course, it's very unfortunate what's been happening, but you've been one of the fortunate, I suppose, recipients of this terrible pandemic.
Thank you. It's a pleasure to join the show today. And you're right that it has been very tough times. And as a outside of hospital care company, because we provide services to people at their home or through digital, the services continue to be required and continue to be relevant to our customers at this stage. To that extent, we've been fortunate, I would say.
So tell us a little bit about how you operate and what you're doing for the community and indeed doing for people who've been infected.
Right at the start of the epidemic in India, around the end of April, early May, we started to work with one of the state governments to help manage COVID-positive patients who are home isolated. Along with the government, we put together the complete medical protocols, used our technology platform, and hired a number of healthcare workers who could remotely monitor these home isolated COVID-positive patients. The protocol was that we would call them every day, check on their health, gather some vitals. If any of them showed any degradation in their symptoms, we would immediately set up a teleconsultation with a doctor, and the doctor would then advise if the patient needed a hospital admission. If there was a need for hospital admission, we worked with the on-ground staff of the government to help move the patient to such a hospital situation. We have since then worked with 6 different state governments across the country, from the north to the south and to the west. And we have managed nearly 300,000 COVID-positive patients. But the good news is that hardly 2.5% of those needed to be hospitalized. All others we have been able to support remotely through the telecom, through doctor teleconsultation, and give them the confidence and comfort and monitor them till such time they were released from home isolation.
I mean, it does seem that you seem rather COVID-specific as a company, but what happens in the post-pandemic world? How will your business have evolved? Well,
the question that I thought you asked was about what we did for COVID, and hence I answered to that. But we are an outside of hospital healthcare company with nearly 8 years of pedigree, and we work across the length and breadth of the company, providing all kinds of healthcare support to patients at home and through technology. So we support patients with chronic diseases, those who are hospitalized and are going back for recovery and rehabilitation, elders who need continuous support, and to some degree we provide primary care. And all of these are continuing to stay extremely relevant in the post-COVID situation. In fact, there is more demand for outside of hospital care than in hospital care, especially where the disease or the condition is such that it can be managed outside of hospital. In fact, what we have found interesting is that insurance companies are now pushing us to help them support more and more patients at their home. There's a very interesting new solution that we have created for one of the insurance companies.
Okay, Meena, I just wanted to ask you more broadly on the virus front. With 10.24 million cases in India and nearly 150,000 deaths, as an MD, when do you see the corner being turned here, I should say? And I guess we're all looking ahead to vaccine rollouts too.
Yes. The conversations that we've been having with the government and the vaccine companies is that the vaccine approvals are imminent. In January, we expect that some of the more risky population would start to receive vaccination, and the more broader population is likely to get vaccinated by the middle of the year. So I do believe that by summer, we should see some good movement in things coming back to a little bit to the normal. That said, businesses are starting to function, no doubt, still distant, still working from home, still partially in office, but perhaps a lot more of a normalcy will return in the second half of 2021.
Do you think that India has been following guidelines strict enough in your medical view? Do you think there could have or should have been more government mandates on things like mask wearing?
Well, the government has from day one mandated mask wearing. There is a combination of government control as well as civic sense, which both have to come in. And there has been a lot of push to drive mask wearing, but on the ground, I do wish that things were tighter. That would be my desire to see that. Because I don't think we are over the hump at all. Even after the vaccine is in place, wearing of masks and social distancing would need to be provided, would need to be followed for quite some time to come, is my view. And I would like to see a lot more tightness in implementation of these guidelines.
And when it comes to your company, we've been talking about some of the opportunities post-COVID. What about any plans for fundraising?
Currently, we are well funded and we have investors with deep pockets. So we are not looking to urgently raise funds. But the interesting thing is because of the post-COVID tailwinds, we see a lot of new opportunities coming in our way, and we see some degree of consolidation in the market. And we are looking at potential raises that could help us in making some of these big changes that we are now anticipating coming our way.
Meena, are you working with the government, talking with the government about the immunization program once the vaccines start being administered?
Yes, absolutely. We are talking to both the vaccine companies as well as with the government. The program of the government immunization is very, very large, as you know, and that requires that all private players such as us join hands with them, just like we did during the initial days of COVID and managing the home isolation. Vaccine delivery, both distribution as well as administration and adverse effect monitoring would require all of us to join hands. So we are in talks with the government to see how we can support them in this process.